Hello, and thank you for joining us. Welcome to another episode of A Focus on Careers. Today, we've got a very busy individual, Azilda Fernandez, who is a registered nurse and is taking time out of her very heavy schedule. As we all know, all over the world, the health services are really under the pump. I mean, they're always working hard, but they've got extra day jobs and night jobs at the moment. So without any further ado, I'd hand over to Azilda to let us know a little bit about her career and how she got there and what she's up to. Azilda, thank you.
Thank you, George. Yes, hello, everyone. I just wanted to let you know how I got into nursing. I'm very passionate about my profession. I've been a nurse for 31 years and have been working in community nursing where I'm currently working for 19 years. So I got started into nursing after doing my HSC. So I did at the time it was a diploma in applied science and into nursing, and then I did my Bachelor of Science degree in nursing, and then from that there's a lot of postgraduate opportunities. So I did my master's in health service management, but
Wow.
I have spent a lot of my careers in community nursing and a short stint in working in the hospital.
Okay, so that's quite interesting. I mean, you obviously, well, I say obviously, maybe not, but you had your sights set on that profession. Yeah.
Yes, because I always loved science and I've
Right.
always loved working with people. So it's kind of like a combination of, with nursing, you have to study biology, anatomy and physiology, chemistry. Um, but there are different pathways to nursing because there's different classifications. So you've got your assistant in nursing, that is currently, I think, a TAFE course. And then if you wanted to do registered nursing or enrolled nursing, you've got to go into university. And to be a registered nurse, it's a Bachelor of Science in Nursing. So that's, I think, 3-year course. And then you can go into different branches of nursing, may it be surgical, medical, ICU, emergency department. So the good thing about nursing is there's so many areas that you can sort of explore and find which one you really like and are passionate to work in.
Right. Interestingly, you were very specific on the area that you focused on, community.
Mm.
And so, could you give us a little bit of explanation on that? Because some of our viewers out there may not know the difference, hospitals and community health.
Yeah, so community nursing is just another specialty of nursing. So, for example, like emergency nursing, community nursing is what you would probably call as well as hospital in the home. So, we look after patients who are discharged from hospital and they don't really need to be in hospital anymore, but we continue with the nursing care at home, which is really good because you find a lot of patient who just really wants to go home and don't want to be in hospital anymore, but they still need their wound care done. They still need their
Okay.
IV antibiotics. Um, and also, there is a branch of community nursing called palliative care. So, patients who want to go home and die at home for their end of life care, we provide them care at home. There's also a branch of community nursing called child and family. So these are nurses who go into the home and look after, provide care for the mothers and babies. So for
Ah,
support,
right.
yes, support after mum's had a baby, supporting mum and dad, monitoring the development of the baby. So it's very varied and interesting.
Hmm.
And I suppose you're not contained in the four walls of the hospital. So it's
Right.
varied. We find it really satisfying because you see the patient in their home environment. So I think it's more holistic because you see where they live, you see where patients live,
Hmm.
their family, because you're not just treating the patient, but you're also providing care for the whole family. So it's, I suppose it's very cliched, but you do make a significant difference in patients' lives.
Oh, absolutely. There's also studies out there that I've
Yes.
seen where people recovery is
Yeah.
significantly faster at
Yes.
home when people
Yes.
are in that environment, a familiar environment, their own surroundings, etc., and with family around them.
Mm,
I think it's important. The other side, as well, as I'm thinking while you're talking about that, is the fact that you're also freeing up beds in hospitals
that's
where,
exactly right.
particularly
Yeah.
at the moment, there are shortages, and
Yes.
that helps that way. So people are not losing the care; they're getting a very personal care
Mm, mm.
by a qualified person who can give them that care at home. It's very interesting because, Azilda, when I think, I mean, admittedly, I've got elderly parents who've been in and out of hospital, and
Mm.
that kind of in-home care for treatment afterwards, etc., is not unfamiliar to myself. But in general, when you're talking nursing, registered nurses, people have got this mindset that it's hospital based. It's always hospital based. So it's very
Mm.
interesting to hear from you that there are quite a number of branches out there beyond the hospital ward.
That's right. Yeah. Well, I suppose I could say that community nursing is sort of undersold and underestimated because, as you said earlier, we do prevent hospitalization and shorten the length of stay for the patients, and also you are providing care in the patients' homes where they are more comfortable, and it's very cost effective
Mm,
because we don't need the hospital beds. We
yep.
carry our equipment with us. Um, and yeah, you just see a bigger picture of what it's like for that patient at home, which helps in their recovery because you are actually adapting to their own environment. We
Yeah.
see ourselves as guests in our patients' homes. So
Yeah.
rather than the other way around, the I suppose the onus of control is on the patient's side. So yeah, it is something that community nursing is not something that a lot of people are aware of. They just
Mm,
think of, if you need healthcare, you need to be in hospital, but
yeah.
that's not the case anymore.
Absolutely, absolutely. So interestingly, there you touched on it a couple of times there, that personal care.
Mm,
So there's a big demand emotionally as well on
yes.
on someone like yourself dealing day in day out with people who are unwell or have been
Mm,
through significant trauma, or as you said, end of life
yes.
situations. So it's it's not something for everybody. Then I'd imagine you need to have a special kind of demeanor. Would that be
Yes.
right?
Yes, that's right. And it's special training as well. But the good thing
Mm,
with community nursing is you also get the same support that you get from the hospital. So we have clinical nurse educators who can
right.
help you out. We also have access to what we call employee assistance programs. So
Ah,
it's support for the
EAP.
staff
Yep.
whilst we're supporting patients and their families, say for end of life care. Our staff also get support with counselling, debriefing, and emotional support. Uh, but also, we get a lot of support as far as education. So, there's postgraduate opportunities. We have continuous education in services that we
Right.
provide for the nurses because it is a specialty in itself. But you find that it's a very supportive environment as well. So you have those career structure. So if you're thinking of, oh, do I just stay in community nursing as an RN? No, there's actually a career pathway as well.
If you so that's interesting. Then
Yep.
there's continuing development,
Mm,
ongoing training, and obviously, uh, you know things are changing all the time, particularly in
Yes.
the health industry, because technology is having a huge impact there, both in the way things are done, the way the way treatments are applied, and also new developments in treating illnesses. Right. So from a one time you're doing it this way, and then all of a sudden someone discovers a new way to do it or a better way to do it. So you always need to be absolutely at the forefront of the latest developments. So that's great that you're provided that.
Yes.
And so you also, as you said, you've got opportunities to develop further. So if you have the ambition and you have the desire, you can certainly take those options, correct?
Yes. So you could be an educator. You can become a clinical
Ah,
nurse educator. You
right.
can have your own specialty, like, say, for example, you can become a clinical nurse specialist in palliative care, in
Mm-hmm.
wound care, in continence and catheterization, because we do that in the home as well.
Right.
You could have a specialty in child and family. You could have specialty in chronic and complex care. So there is a career
Wow.
pathway.
Wow.
Yes, so it's very varied. And the thing with community nursing is the skills that you gain, it's very transportable, transferable. So you could probably practically go back to the hospital and be, you know, adapt to the skills that's needed there as well. Go overseas and work overseas. So there's lots of opportunity with community nursing, because it really is still the same skill as being a registered nurse in the hospital.
Yeah, that's interesting. You mentioned the transferable skills,
Mm,
and that's something that's yeah people need to be conscious of. Right, when you're deciding on a career, you're embarking on a career. It's great to have a career that is transferable. I've got several friends of mine who are registered nurses and currently working abroad, right?
mm,
Because they can. So it's an opportunity to live abroad, learn different things, and take that skill and then come back to home, Australia, or wherever it is, and practice again. Now, a question on the nursing sort of demographics.
mm-hmm.
Are you finding what's the gender split there? I mean,
It's still,
men,
yeah,
yeah,
it's still predominantly females. However,
right.
just for example, in my team, it's probably 50-50.
Ah,
So,
interesting.
yes, so there's a lot of males that are taking on nursing. And you'll probably find that with the new graduates that we take on, because we have what we call a new graduate program. So it's a rotation program. So once they finish their course,
Mm-hmm.
they have an opportunity to work in different specialty, and community nursing is one of them. So they rotate. Say, for
Ah,
example, they're 6 months with us and then 6 months in the hospital. And after they do their term, it's almost guaranteed that you would have employment. So,
that's so interesting. I mean, it's very, very sophisticated from an
mm,
onboarding and training and ongoing professional
that's right.
development perspective.
Yes.
And again, you know, no disrespect, but it's not something that I
Mm,
really thought of in when looking at registered nurses. So I thought you did it, you got the course, you finished it, you sat in, and that's it, right? But clearly here you've got
mm,
internships and you've got
that's right.
professional development and cross training, so people get a feel for all the aspects and then can
Yep.
slot into one that they feel comfortable in. Now, again, unfortunately, having been visiting hospitals more often than I would like to for family reasons, I noticed that there was quite a number of foreign nurses in
Mm,
from the UK, from Southeast Asia,
mm.
etc. Is there a short? Are we a net importer of talent, or because we have a shortage, or is it that ours our graduates are going overseas. How do you find that in your day
Yeah.
to day?
I, I I think previously at some point we were recruiting overseas as well, but
Right.
we are also finding this is pre-COVID that
Mm-hmm.
we have a lot of new graduate nurses that couldn't get employment.
Oh.
Okay, but the situation has flipped now because nursing is in demand because they are being employed in the COVID clinics, COVID testing centers, vaccination hubs. But there's also different models of care now. So there's telehealth. You're probably aware
Mm-hmm.
of it, George.
Mm-hmm.
Like they
Yep.
use that a lot in regional
Mm-hmm.
virtual care. Supporting now with COVID, with the pandemic, we have a virtual care, we call it, and we support the patients who contracted COVID and doesn't need to be in hospital, but they are isolating at home. So
Ah,
the
right.
follow-up, the follow-up, the monitoring, the care, the supporting care comes via virtual care, which is really telehealth. So
Mm-hmm.
for example, the nurses are ringing the patients sort of every day, or depending on how often they needed to be monitored, and just asking, well, how are you feeling today? Doing their OBS, giving health advice. Do you need to go to the hospital now? Do you need to go and see the GP? So yeah, so it's also the different models of care. It's not just about home visiting. It's
Yeah.
also, as you said, using technology. So telehealth, you can have like a Skype meeting, a Zoom meeting, and you are communicating with the patients
Mm-hmm.
in their own
Wow,
home.
that's yeah, absolutely the introduction of telehealth, which, as you said, had previously
Mm,
been focused on rural areas, and where doctors and GPs don't necessarily uh, operate. So people are dialing in and having a chat to their GP that way, and it's become actually the norm now. I mean,
yes.
you don't even need to go into to get a script anymore. You can
Mm,
book a telehealth, and they send the script to the
to the pharmacy.
pharmacy, and yeah, it's all seamless. So,
Mm,
tell me, with your extensive experience across this career path here, what has been the most significant development in that time, like from a nursing perspective? I mean, there's the stereotype of 70 years ago, 100 years ago, whatever it is, nursing, and it's evolved significantly to be a a very highly respected career, highly respected profession,
mm.
leading the charge more often than not in that medical environment. What have you seen as the greatest
Yeah,
development change?
yeah. Well, as I said, you've got 31 years experience in nursing. So historically, nurses used to be at the job training until it became a university course. So
Right,
that happened in I think it was 1989 or late
uh-huh,
1980s. So
right.
I was the third batch to graduate from university. So that's probably the development. It became, nursing became a university degree. But as far as seeing the development, as you know, with technology, so a lot of our nurses are quite tech savvy because they have to be able to navigate electronic medical records, or say, for example, community nursing, they use laptops when they go see
Right.
patients in the home, and that's how they
Yeah.
access health information and supporting them in their practice. But the other thing that I've noticed also is, it is true we are an aging population. uh, Previously the lifespan would be 75, 80. Now we have a lot of patients that are living up to 100, 101. Yeah, so we are living longer, but living longer comes with a lot of issues with it as well. Because especially if you want to stay at home while you age and don't want to go into a nursing home, you need to be surrounded by services, supported by services in the home, so you can stay at home and spend your last days in the home that you want to be in.
Yeah, that's been incredible developments that you've
Mm,
witnessed, and you're absolutely right. The aging population, life expectancy is significantly higher than it was, but that the quality is not
mm,
necessarily there as well. So you do need that, and you've got you referring to technology. Also, the diagnostic tools
mm.
have changed tremendously. I mean, from even the old blood pressure pump thing, now they just put something on, and the oxygen levels, they just
That's
put it
right.
on your finger, and it's all. So yeah, it's quite interesting, the developments from that perspective. So what is, on average, I mean, you've been there a long time. It's a career. It's a passion. What is the turnover? Do you find a high turnover? Do you find people who graduate nursing, get into nursing, dropping out and doing something else, or what's the career
Yeah.
expectancy?
Well, I get the sense that we do have a very low dropout rate, only because, if you want to venture out of your specialty, you can work in another specialty or
Right.
go overseas and experience a different culture. So I get the sense that we don't have a high percentage of dropout rates. You just
Great.
change specialty. Say, for example,
Yeah.
before I worked in community, I was working in a high dependency surgical unit. I've worked in orthopedic. I've worked in ED, and then I found community nursing and have never looked back. Only because it's, with community nursing, I suppose it's more family friendly.
Mm,
We don't
mm.
do a lot of shift work. The hours are a bit more
Ah, right.
stable. Yes,
Right,
yeah,
right. That
yeah.
makes sense. That makes sense. And that was my next question. The being on call all the time, and I
Mm,
guess it's different. Emergency room nurses is different to others. Are general shift work, but I suppose that your time in the ED was a tremendous learning
oh,
experience. Yeah.
yes, yes, yeah. And ED is always interesting because you just don't know what's going to come through the door. Yeah. But you can do that while you're young, George. As you get older, you can't take too many surprises. But
Fair
it's,
enough.
yes, but it's a very, any areas in nursing is really very rewarding. You learn a lot about people and what people
Yeah.
are like when they're the most vulnerable. But I think during that time too, that is when you make the most um, difference in their lives, when you see somebody who is at their end of life and making them comfortable, pain free, and supporting their family, not
Yeah.
just during the dying stage, but the grieving. We do a lot of bereavement support as well. So yeah, I know it sounds cliche, but it really is you make a significant difference in people's lives.
Oh,
Yeah.
you've got, obviously you can hear from your tone and the way you've talked about your career that
Mm,
it's something that you've thrown your whole heart and soul into, and you need to
mm,
uh, being dealing with these difficult issues with people. They're all individuals, they're all people, and being able to have the empathy there, and to deal with the grieving and so on. So
mm,
that's why I was saying earlier, it's certainly not for everybody, because you need to
mm,
be the training is great, and you mentioned that, but I think you do need to do it because you love to do it, and you want to
mm,
do it, and which leads me to my next question is that, walking to a medical center, walking into a hospital, walking into a ward at the moment, I'm seeing things that I've never seen before, like
mm,
warnings about violence and aggression will not be tolerated, and these sorts of things. So obviously there is, people in their vulnerable state,
mm.
can be impatient, can be aggressive, can be difficult.
Yeah.
Yeah, and
Yeah.
and you deal with that, and how's that handled? How do you manage that?
Yeah, we also train our nurses to do. de-escalation of aggressive behavior.
Mm.
We also resource them with a lot of communication skills because, as you know, aggression happens when people feel that they're not heard or they're not being listened to. So, yeah, we do a lot of training around risk management, um, communication, like high level communication skills,
Hmm.
and also detecting risk before we take on
Wow.
patients.
Wow.
Yeah. So yeah, there's varied training around. I mean, we're not mental health nurses because another specialty is mental health nursing. So we do a bit of
Hmm.
that just to be able to deal with patients because not all patients are straightforward. We call them that they have comorbidities. So you might be doing, for example, visiting a patient with a wound, but they also have mental health issues, and
Right.
they could be drug and alcohol history. So knowing the full picture just arms us with information that we can deal with. So fortunately, we haven't lost any nurses. So it just shows you that we take these risks seriously, and we train our nurses, and yeah, we provide them with equipment as well. They carry mobile phones with them, duress alarms if needed. Yeah, so all those training comes with that. So yeah, and
Wow.
the
I mean,
nurses feel confident.
you throw everything at this. I mean, this is quite incredible to
Mm,
hear from your perspective, the amount of effort put in from a learning, development,
mm,
coaching perspective. It's fantastic. So obviously the best part of your role, the best part of your job is the caring, the really making a
mm.
difference to people's lives. What about on the negative side? What do you dislike, or
Uh, the,
what's difficult to deal with?
yeah, what's difficult to deal with is when there is a higher demand than supply. What I mean by that is there's more patients than nurses.
Right.
So, sadly, sometimes, and actually most of the times now, is we have to create wait lists, just like in ED, you have to wait for your turn.
So
So we do
triage.
have, yeah, triage. So we do have that as well. And I suppose if you're working in the hospital, the shift work is a bit of a downside,
Yeah.
but that could be also an upside because you get penalty rate, so you get paid more if you're working shift work.
Yeah.
Yeah, so there's not really many downsides that I can see because as you speak to many registered nurses or nurses in general, I mean, they've been in the game for a long time. So the benefits or the positive far outweighs the negative that you expect. It's just like with any other jobs, and it's never
Yeah.
boring. It is
Well,
never boring
yeah.
because
There
every
you go.
day is not the same. Every day is different.
There you
Yeah,
go.
yeah.
Absolutely. There's no question
Mm.
about that. So, what would you, what would you sort of guide, or what would you suggest people thinking of getting into this career, sort of subjects they should be doing at school, or does it really matter? Because, I mean, maths, biology, or you pick it all up at uni. What do you
Yeah,
think?
well, maths, I mean, but it's like your, what do they call it? Your basic maths.
Yeah, general.
It's, yeah, general maths, it's essential, but science, but not necessarily. You can go into nursing by doing an assistant in nursing course in TAFE or enrolled nurses. So that just gives you a taste of whether nursing is really what you want to get into before
Ah,
plunging into doing a whole university degree.
well, that's a great
Yeah,
suggestion. That's very good,
yeah.
and you can do that.
You
Any
can
you
do
could do
that.
that while you're
It's a
doing year 11
certificate.
and 12, or.
Yeah, I think it's a certificate 3 or 4 because you can do a
Mm-hmm.
certificate 3 in aged care,
Right.
certificate 3 in disability. So that just gives you a taste, and that will give you an opportunity to work in the hospital. work in aged care or residential aged care facilities or group
Mm-hmm.
homes. So,
Mm-hmm.
yeah, that just gives you a taste of, okay, so this is what nursing is like. And then you advance into the more technical and higher level sort of nursing, where you will be working in ED, ICU, surgical medical wards, or maternity, or theatre, or community nursing.
Wow.
So yeah, there's different ways of getting into nursing, but getting into assistant in nursing and enrolled nursing just gives you a bit of a taste of what nursing really is like.
Well, what a brilliant suggestion. I mean, that's very good idea for people out there thinking or considering this career and not really 100% sure about
Mm,
it. That's fantastic. Well, Azilda, thank you very much for the time you've given us and the incredibly insightful overview of the registered nursing career side and the various aspects of nursing that people can get into. So if anybody out there has got any questions, drop us a line at the email
mm.
at afocusoncareers@gmail.com. Let us know and we can get Azilda to get back to you on any questions you may have. And also, if you or anyone you know has got an interesting career they'd like to share with us, it'd be greatly appreciated. You can drop us a line on that as well. So, Azilda, thank you once again for your time. I know you're very busy, and I know this is eating into your personal time as well. So, very grateful for your contribution here, and I'm sure young people and people thinking of career transitions will find it incredibly helpful. Thank you so much for your time.
Thank you, George. Happy to help.
Thank you.